This is a question we have been asking since we have developed our resources, and we have been building resources in the area of psychosocial oncology. How much does it help? What does it mean if we can answer or we can, satisfy some of the psychosocial needs? What does it mean for a person? What does it mean for a vulnerable group of cancer patients, like lung cancer patients? So I can tell you that for many years, consistent with the National Comprehensive Cancer Network guidelines for distress screening and management, and also based on the Institute of Medicine report, based on their recommendations, and also based on all the emerging data and evidence that we see, we have been quite sure about the moderate to significant impact of the psychosocial interventions on decision-making, on quality of life, on well-being, and also on the connection, collaboration with the medical team and with the medical treatment. So this kind of very clear benefits were proven or have been proven all along the way. So this is why we say that not just in clinical care, but also in clinical trials, psychosocial and educational interventions should be provided to all cancer patients, and of course to all lung cancer patients at all stages of the disease, because there is clear evidence that they are improving psychosocial well-being and also quality of life through the decision mechanisms and through the communication mechanisms that are enhanced. And I think it's very important to understand that the cancer experience is also a highly personalized experience. So for a person affected by lung cancer, decision, communication, well-being are as important as getting rid of the cancer, like, the physical part of the cancer. So in my understanding nowadays, and I say this because you will also came across these studies in my presentation. Nowadays, it looks like we are ready to take interventions, psychosocial interventions, to a next level, and we should try to be open to discuss these interventions in the perspective or towards the survival goal as well. What I am talking about? Well, I'm talking about the fact that there is some research from the last years that actually proves that psychosocial interventions are associated with survival in some cancer patient groups. For example, we have one that is about the lung cancer patient group from 2017, a study which revealed that psychosocial factors might play a role in the lung cancer specific mortality and survival, which means that in this study it was found that the depressive coping, emotional distress, and anxiety as well were all associated with a shorter survival, and also they increased lung cancer specific mortality, even after the authors controlled for the demographic, biomedical, and other treatment prognosticators. So this is a very important study when we are talking about psychosocial interventions in lung cancer going towards survival. But also, as I just mentioned, in other cancer patient groups, like gastric cancer patients, there is a very new research that came out like 2 weeks ago in the Journal of the National Comprehensive Cancer Network, which actually says that quality of life, and proves it, is associated with survival in patients with gastric cancer as well. So my hope and my understanding of the data, of the emerging evidence that we have, is that psychosocial interventions are established with benefits in well-being, quality of life, in collaboration with the onco team, but with the perspective is going towards the survival planning and also making a difference in this survival landscape. So this is what I would, just make sure that we understand, and also that we leave a door open to having more data on this possibility.